you so much, John. I am so glad that everyone took time out to join us tonight. Really appreciate the introduction and the opportunity to share some information with everyone. I am Kyle Basham, urologist at Baptist Health here in Fort Smith, and with the phone number there on the screen, we'd be happy to help you all out and get an appointment if needed later on. But let's get into this and learn about some of the options we have, as he said, about these types of problems. Now, um, overactive bladder affects a lot of people. And, these are some of the questions people ask, will I gain control? Can I leave the house? Can I go to places I used to like to go? And people make these changes and they unfortunately stop doing a lot of these things in life because they're embarrassed. But it's time for a change. Unfortunately, a lot of patients don't choose to discuss these type of problems with their doctors, and a lot of primary care doctors don't necessarily, bring it up or ask about it as long as everything else is going along. It is and can be an embarrassing topic, as we understand, but you're not alone, and there are options, and you can get help. So that's what we're here to learn about. These issues are not inevitable, and in living with them is not either. And so if you have any of these type symptoms, the sudden urge to urinate or use the bathroom, going more than about 8 times a day, if you feel like you're planning your life and activity around going to the bathroom or knowing where one is, or making different stops on the way to and from places, you started, limiting your fluid intake and not able to eat and drink what you want because of these problems. These are all things that are obvious signs that you may have this problem. And just know that there are ways to get treated. If you're to the point of having to use pads or protective underwear to control leaks and getting up multiple times at night, which obviously starts to affect your sleep, it's time to probably tell someone and possibly do something about it. So you again are not alone. These problems can affect people of all ages. It is some ways more common as we get older, and I've heard that from patients. Well, I just thought it was normal with aging, and it is, but that again does not mean that you just have to accept it and do nothing about it. But as they progress and get harder to control, I mean, people lose sleep. They have, more of a psychological, mental side where they lose self-esteem and again start not doing things in life that they used to love to do just simply because of these bathroom problems. And so 1 in 6 adults have some form of a bladder or urinary control problem, and that's nearly over 40 million people. And so again, you're not alone. So don't be embarrassed to seek out help. Bowel problems are another issue that affect a lot of patients as well. Again, very embarrassing, we understand. And even when patients are here talking to me about their bladder problems, they usually will not even tell me just out of the blue that they have some of the bowel problems as well. But I ask them because I want to try to take care of them best we can. And then so many people do as well. So again, not to be embarrassed, not to, just try to accept it and live with it. So the good news, as we hope, is that there are treatments that can get you back to having that freedom, the quality of life, the life that you used to have or want to have, and then just more control over both the bladder and bowel, but also your life in general. So then, from an education standpoint, and you're here to learn about what's going on and then eventually some of the treatment options, but well, what causes these problems? And so it's a combination of a lot of things, and habits, including what we eat and drink, affect the way our body behaves. Things like caffeine and things like that are not necessarily real good for the bladder. It seems like, especially as we get older. Certain medications that we take for different health problems can lead to, a little bit more urinary, symptoms and things. And those are the type of things that we look at and see if there's any adjustments that can be done. And then sometimes the past that has occurred that affects us now today, pregnancy, and whether or not you give birth or not. In some ways, pregnancy can still affect the future of things, and then multiple childbirth and other pelvic floor injuries or surgeries that have occurred possibly for other things can all affect how these bladders and bowels function. So how do some of these things work? Now, your bladder is naturally wants to go very frequently, just like, say, a baby does. And when it's ready to go, it just goes, right? But over time, as we get bigger, our brain starts to take more control over the bladder and tell it to, to not go necessarily all the time. There can be kind of communication breakdowns between the brain and the bladder for various reasons, and that's where some of these problems can come from. So the bladder sends a signal to the brain to tell you it's full, and you should, receive that signal and kind of feel that you need to go, but then you should be able to, postpone that for a while. And so when that breakdown occurs, sometimes that signal to say don't go doesn't make it, and the bladder just goes on its own. And so these are some of the ways that we try to intervene to actually make the symptoms improve. So Medtronic bladder control, kind of works on these nerves. Some of the nerves that come out of the lower part of the spinal cord, where it's going directly to the bladder, and try to help that communication be more appropriate overall. Same with the bowels. We eat our food, pushes through our bowels. We should have a stimulation and feeling that we need to go, but we should be able to hold that. That's part of how we are made. And so when that communication breaks down, there are muscles within and around the bowels that will just lose control, and then sometimes the stool leakage occurs. And so same type of therapy, working with the exact same nerves really, can help both the bladder and the bowel problems. Other urinary incontinence issues include stress incontinence, which is coughing, laughing, sneezing, picking up heavy things that cause urine to leak out. And then on the flip side of that, some people have urinary retention, where the urine will not leave the bladder as it should. And then on down to overactive bladder, or some of the symptoms like we talked about before. So again, about stress incontinence, these how I ask patients to say, if I'm trying to figure out, well, do you have more overactive bladder, or do you have more stress incontinence? I say, do you leak when you cough, laugh, and sneeze, maybe pick up something heavy? And they say, well, a little. And then I'll say, well, would you go jump on a trampoline? And they usually laugh and shake their head and say, oh, no, not at all. And that tends to be a lot of stress incontinence. Anything that kind of creates more pressure inside of our abdomen, perhaps will cause that urine to leak out. Same risk factors that cause that. But a different type of treatment, honestly, because it is a different mechanism that's occurring sometimes. With urinary retention, some people can't even tell when the bladder gets full. That again, that nerve communication breaks down. They don't get the proper signals to the brain to say my bladder's getting full, and so they may not know that they're holding onto all this urine. They may get infections. They may also have incontinence because the bladder's so full it just starts to kind of dribble out and go at all times. Some people have to have a catheter or some sort of a drainage to get the bladder to empty. But Medtronic therapy can, again, reestablish that appropriate communication and get the nerves to talk correctly to hopefully be able to get that to function more normally. And so people tend to take these issues for granted until they're a problem, and then they're quite bothered by them. Overactive bladder is what we talked about mostly earlier, which is so common. Those numbers, speak for themselves. 50 million people dealing with some version of this, and the two main, kind of symptoms are the urgency and frequency, as it says here, but then also that urge incontinence compared to the stress incontinence. So the urge comes from the urgency, right? When I get that sudden urge to go, I'm leaking before I get there, and that's kind of how I ask that. Do you just not make it to the bathroom in time? And that's usually kind of how that's separated there. Also, they may feel like they don't empty the bladder, but that's just the bladder being overactive, and it just barely gets anything in it. They go pee, and then they say, oh, I feel like I didn't empty, because just a few minutes later I feel like I need to go again. So a lot of times that again is just the bladder that's overactive, that won't be quiet and won't leave you alone, kind of constantly bothering you there. Frequency, having to go multiple times, day and night, intervening and interrupting your life and sleep, or a lot of that as well. And so everyone has a little bit of a nervous bladder, right? Something is about to occur, and you may feel that need to go sometimes, but some of these patients, and maybe some of you have that all the time, all day, every day, and then you can never get it off your head of sorts. So that's when, again, those behavioral changes start, and the other things of life start to change. The fecal incontinence is simply that of some sort, which is where it's a leakage of stool or fecal matter without, at times when it's not wanted. And so that urge to go hits you, and you don't make it to the bathroom in time. You're having to change underwear and pads. It obviously very embarrassing and life altering for a lot of these patients. And so people again start to change diet, which can help. Start to really watch what you eat and where you go, and making sure that you're not going to have one of these accidents and be in a place where it's real obvious for other people to know about, unfortunately. So how do we get control? And this is some basic slides about it, but I do want to mention is that I mean there is there is a pathway, one that is developed in some ways from a large nationwide standpoint with large entities that treat these things, but also us personally, here at the Baptist Health Urology Clinic, we have a pathway that we take you down. So by the time you get to us, sometimes a lot of times people have done several of these things, as it's mentioned here, lifestyle changes. You've already done both good and bad things to try to help control this. Oral medications. A lot of primary care doctors may prescribe a medication to try to calm down the frequency and urgency if that's something that you've mentioned to them. And then if that still isn't working, that's where we move into occasionally some of the advanced therapies, or in some ways third line therapies. But again, there is an algorithm, and I mean we will take you through that. We'll show you the pros and cons of this, and go from that. So you won't be tossed into a big nebulous pool and have no idea where we're going. But we'll have a way of getting you through these steps and take you or figure out where you've already done and where you've been, and then move on down further if need to. So for those lifestyle changes, like I mentioned, these things may not work for everyone, but we still always encourage it. We want to do everything we can to do as many things as we can to help you. But the diet, we kind of avoid a lot of real crazy spicy foods. We avoid a lot of caffeine, some things like that may just literally irritate the bladder sometimes. Exercise, and in some ways, general body exercise and pelvic floor exercise all go in together, just, kind of keeping muscle tension and nerves happy and healthy, and trying to, keep your body functioning well. And then a little bit of what we call biofeedback or bladder training, kind of teaching your bladder that it's okay to not go every 15 minutes, in some ways kind of training it and doing some maneuvers that kind of help to calm it down sometimes, just to give you the feeling like you may not need to go, and in some ways just try not to give into that urge the second it hits you every single time. So these things are things that we do. People find a lot of these maneuvers and things online and different things, so a lot of times they've done it already. And they're still unfortunately not where they need to be. So then we move to oral medicines, very common. There's lots of different medicines. They've been around a long time. Unfortunately, between either not working very well or causing a lot of side effects, most people don't wind up taking them for very long. They can actually work okay. Saw some patients today that had been on some of these, and they said, yes, it did help this or that, but I had terrible dry mouth, and I've had constipation, which was worse than before, and things like this. And then, occasionally even cause, real problems like hypertension and some problems. So they wind up not able to tolerate these pills just because of the side effects. Take them every day, take them forever. They don't, really fix anything. They just kind of cover up the symptoms. And then there's always insurance coverage issues, things like that, which cause people to not be able to afford them. And so they usually, as the statistics show, will wind up stopping them within, 6 months or so. Or we're just constantly switching from one to another to figure out which is going to work, and some of that. It's still always worth a try, and it's usually reasonable to try these just to see, how a patient responds, but they don't tend to be really the best thing for the long term. They're overall, when you poll patients with these type problems, if you just take the whole group, most patients are, unfortunately pretty dissatisfied with their treatment, especially if they're just on medicines. They try to take them here and there. They try to minimize taking them because of some of the side effects that they know that come from them. So they'll just use them, only when they're going to travel or do this or that, because they know it causes too much problems otherwise. And so If that's all you have, well, most people don't unfortunately even come back to the doctor. If they think if this is as good as it gets, well, I'll do something else, or I'll just live with it at that point. But there are other things, and that's obviously part of what we're here to educate you on, but also deliver for you. So if all these things don't work, advanced therapies, or I still refer to it a lot of times as third line therapies, are still there, and definitely a big part of how we get patients to actually having symptom control, and not have these terrible side effects. So for both the bladder and bowel control, the InterStim system from Medtronic can kill two birds with one stone, if you will. If you have both problems, then it's a really great option to look into. Either or also, but that's one thing that I really like about it, is being able to help both problems in one patient. There are other types of nerve stimulation therapies for the bladder side, and then when it goes to bowel, there's not much else other than some surgical options, and again, aggressive diet control, things like that. May have heard of Botox injections for the bladder. That's considered a third line therapy. We do that on occasion for people for various reasons. We put a telescope into the bladder and inject the Botox medicine directly into the bladder wall. It does help some patients. Unfortunately, it does wind up having to be repeated over and over again, as with any Botox treatment that you may know of. There's a lot of repeated treatments involved, and so it can cause urinary infections. It can actually cause the bladder to go sort of paralyzed, and then you have to have a catheter of some sort for a while. So it's also not without its limitations or problems. So the percutaneous tibial neuromodulation treatment, as the picture shows here, is by using a very small, like acupuncture needle that goes into and around the nerve down by the ankle. And it's very safe and quite effective, and very minimally invasive, because this is it. It's done here in the clinic setting, and it's been proven to reduce these symptoms: urgency, frequency, and incontinence. Some of these nerves are connected all back up at the spinal cord in the same ways, and so it can still affect the bladder in a way that's productive, just even by using this treatment at the ankle. It's done just in the clinic here, and we do have this sort of weekly session for about 30 minutes or so, for about 12 weeks to start. Kind of has to get that nerve communication reestablished, but then we have to kind of hang on to it. So then usually patients come back about once a month for a maintenance type therapy, and they'll do that for as long as they feel like it's helping, and it helps some people for a very long period of time. There's nothing permanent. There's nothing implanted. It's all external, and just treatment of that nerve, just for that short period of time, but yet still works for days and weeks even after a treatment's done. The sacral neuromodulation is more commonly used from a number standpoint, and in some ways better because of a little bit less on your part of sorts. So again, a small wire goes down to the nerves that come out of a certain area of the lower spinal cord that go to and from the bladder and the bowel, and then this gentle stimulation on that nerve kind of helps to, as we call it, modulate the communication between the bladder, bowels, and then the brain. And so when you look at it from an effectiveness standpoint, better than medicines, and certainly really sort of no side effects. It's certainly not the ones medicines cause. We do perform usually a small test just here in the clinic, with just a small little wire that goes in, just to see if it's going to work before we would implant a permanent device, so to speak. But if so, a very small little device gets implanted just under the skin, and it sits there and it does its job, all the time, day and night. There's options of different types of batteries and how they work that you can pick from, but ultimately, the point is that it can give you this lasting effect without having to really do much on your part overall. When you look at this treatment, people still kind of look at me like I'm crazy sometimes when I bring this up. And I say, yeah, it's been around a very long time. You probably never heard of it, but lots and lots, as it says here, over 375,000 people have had this. And ultimately, there are lots of patients that have had it for years now, if not decades, and still benefit from it in one way or another. And so when we go and we're looking at potentially doing this, well, again, we usually use a test procedure here in the clinic, which is very simple, no anesthesia. You can come here and go home that day without anybody really even helping you. And we record our symptoms over the next few days to see if by stimulating this nerve, it's going to give us the effect that we want, and then we can choose whether or not we go and have the other implant put in. Over 80% have achieved success at 5 years, as it says here. And I would say, perhaps, well over 80% of the patients that we usually go through a test on wind up getting benefit enough to want to have the implant put in. Success is technically defined, and I bring this up with every visit as well, as a 50% reduction in symptoms. It's hard to make people perfect, right? No matter who you are or what you're doing. And so improvement and success are very common, but we have to have appropriate expectations. But I try to be very honest about that from the get-go. So the good thing about the current models of these systems is that they're completely MRI compatible. Older ones were not, and so we had to do some things there. But there's a setting that goes into, you can have an MRI done and almost of any sort, of any kind, and it was totally safe and everything, and then you just turn it right back on afterwards, and no big problems. So we don't have to worry about that like we did, several years back, and kind of picking and choosing which patients would get this based on maybe if they would even need an MRI or not. Now it doesn't really matter because you can get one. So is this right for you? Well, you might be a very good candidate for it. If you've got these symptoms that, that you feel are significant, maybe you've tried some of these lifestyle changes. And if you haven't, well, then maybe you'll try them now, know a few things to do, and or some medications. You can talk with your regular doctor about that if you want to start there, about, starting on a little medicine or something, or if you have and failed it, switching to another one or something, or we can do that for you as well. We, still prescribe these every single day and try them for people to see if it's going to be that simple. But if you still haven't gotten the relief you want and you're still feeling there's, you just like more improvement of symptoms, plus or minus all those other things, well, then this might be right for you. And so when you look at, the outcomes of it, which is what we're concerned about, right? 84% satisfaction for bladder issues, and 89% bowel control, long-term success. So when you look at those numbers, you'd say, well, it's pretty easy to say that it must work for most people, and 3 times greater improvements in the quality of life compared to medications. I treat a lot of other things, and some of which are not, all quality of life. I mean, we do types of different things for cancer and things like that, which are a lot different, right? And what you have to deal with that is different compared to this. But this is for your quality of life. This is for your, just everyday life that you're living and how it's affected you. And so, the way that we can affect that in some ways is actually even greater than with some of the other types of things that we deal with as urologists as well. So a quote from a patient that has an InterStim, not living in the bathroom, but I'm living my life. And so if you can resonate with wanting to be that way, then maybe it'd be a good time to talk about some of these other things. And again, when you call here, or we can get you connected and get an appointment, you'll see me or perhaps one of our advanced practice providers here as well, to get you plugged into this pathway and get these things going and get a plan. We expect a pretty tight schedule on how these things would work. So we hope that we would be able to give you some say, well, we're going to start here, and by this date we'll do this, and this date we'll try that. And so try to get you some some expectations that you'll know where you're headed and where we're going to be taking you along the way, along there with you, because I know you can get lost in the sea of a lot of patients sometimes in some practices and in other things, but we'll do our best to make sure that doesn't happen. So any more questions? Maybe we'll be taking questions here in just a minute. But again, here's our clinic phone number. Our Baptist Health website has some information as well about making an appointment and some other general information. And then, Medtronic has a service through the interStemAmbassadors.com to where you could actually communicate with someone that has this, and they can obviously tell you a lot about it and some of the process there. And then the Medtronic website to sign up for information or look things up there as well. There's a lot of good information there as well. But if you at all have, would like to discuss it more in person, we'd be happy to get an appointment set up and go from there. And again, I really appreciate everyone's time and hope you've learned something. Hope that if found something in this helpful, and if I can be of service to you in any way going forward, please don't hesitate to reach out. We would we'd like to help you regain that quality of life and take back the things that you'd rather do. So all right, now we'll move on to questions. Stop share. Do we leave the meeting?
She said there was a stop recording button. Maybe it.
There was stop sharing at the top. Oh, okay.